Hi, I'm Katie Beresford, and I'm going to be sharing the research findings from my summer internship, which explored the effectiveness of forest school on the health and development of preschool-aged children. To begin with, I want you to imagine what you think of as a healthy childhood. In his book Last Child in the Woods, Richard Loeb develops the concept of nature deficit disorder, which is the idea that humans have an intrinsic need to be affiliated with the natural world. He argues that a reduction of outdoor play can have negative impacts on children's well-being, health and development. Scholars have argued that we have a crisis in the UK as children's lack of engagement with nature is somewhat contributing to issues of childhood obesity, poor social and emotional skills, and behavioural problems. My internship involved producing a literature review of research on forest school, which considered the effectiveness of forest school on a range of health and development indicators, as well as identifying characteristics of children accessing the programme. Forest school is an educational practice emerging from Scandinavia that aims to immerse children in a woodland environment for the benefit of their holistic development. The research found that forest school is effective at improving the holistic development of preschool-aged children. This included improving their social and emotional skills and their cognitive development. It also found that forest school encouraged children to be aware of their environment. There was no explicit links made between forest school and increased physical activity. However, findings did show that forest school had a knock-on impact on children's home life, where children asked if they could repeat activities they had done in forest school with parents, encouraging families to spend more time outdoors and thus potentially increasing levels of physical activity. Very few studies discuss the accessibility of forest school or describe characteristics of the programme, although there is some evidence to suggest that forest school takes place in multiple regions in the UK. More work needs to be done to improve access. Although the literature clearly highlighted a need for future research, the current literature shows that forest school has the potential to offer a creative and innovative solution to public health problems. Overall, the internship was a highly enjoyable experience which developed my communication, writing and collaborative skills, and also aided in the development of a professional network. The internship included a range of outputs, including a presentation to County Durham Sport, a blog and research briefing, and sharing findings with academics and practitioners.
Hello, my name is Katie Denham and I'm going to be talking to you briefly today about my internship at the NIHR School for Public Health Research in the summer of 2021. As the title suggests, my internship was part of a much larger project which was led by my supervisor Emma Adams, aiming to explore and better understand experiences of accessing community mental health and addiction services for individuals experiencing homelessness during the COVID-19 pandemic. To do this, a qualitative research style called interpretive phenomenological analysis was used on interviews with both service users and service providers to capture a more complete picture. This style aims to draw meaning and themes from the threads running through the words of the research participants, rather than imposing themes onto them or attempting to make them fit into preset criteria. Through doing this, it aims to achieve greater depth of understanding of the complex life circumstances many of the research participants experience, a depth and nuance which can often be missed in less involved research methods. A key component of this research was also the use of co-production and involvement of experts by experience at every stage of the research. They were consulted on the research design and gave feedback on the provisional and final results, both through focus groups and written feedback, an essential component of trying to understand and well represent a so often misportrayed and underrepresented community. One of the questions I was asked to answer in this presentation is, why does this research matter? Why is it important to the general public? In my opinion, the research is of vital public importance as it aims to develop understanding of what is a traditionally challenging and complex problem, which has not only received a paucity of research attention, but also often eluded understanding over the years. The health system in this country, for both physical and mental health, including addiction services, was founded on the belief that in a civilised society, everyone deserves to receive a baseline level of care that's free at the point of delivery and to ensure that no one slips through the net. Yet we have a group of society still in 2022 whose access to that basic level of care is severely impaired, and for reasons we don't yet fully understand as well. This impaired access of those already amongst the most deprived then fuels a cycle of increasing marginalisation, leaving them ever more disadvantaged. So, to summarise the outcomes of my internship, I had the opportunity to get involved with multiple parts of the project, from carrying out analysis of subsections of the interviews with service providers, to undertaking a part of a literature review, to meeting and networking with different members of complementary research teams and getting a real insight into what they do. I gained invaluable exposure to a novel and innovative style of translational public health research, as well as different researcher styles, seeing how they balance different projects and manage workloads, and gain an insight as to how to get involved with larger existing projects as well. There's also some quotes here from the transcripts of interviews with service providers that form my section of the analysis. I've picked these out as they really illustrate some of the key themes drawn out from this research, and you can pause the presentation to read these at your leisure. I spoke about this experience in more depth in my blog, which you'll also be able to find on my NAHR page, as well as contact details and links to find out more about the project. Thanks for listening today.
Hi, my name is Katie, and in summer 2021 I completed an internship with the National Institute for Health Research. I'm going to start by telling you a brief story that I'm sure you're already very familiar with. The date was March 2020, and COVID-19 was rapidly spreading. Side note, I'm not sure how scientifically accurate my drawings are. As a result, there were mandated school closures worldwide. This meant that children were now having to learn from home. As you may be guessing, my project was about the health impact of school closures, specifically the mental health impact of school closures and other COVID-19 mitigation measures on children with autism spectrum disorders. To investigate this, I conducted a literature review to survey what is known about the impact of the pandemic on children with ASD. When I started, there were 376 articles, and through various screening processes, I whistled it down to 69 articles. Before getting into my findings, why is this research important? So there are reasons to think that children with ASD could be more susceptible to the impacts of school closures. For instance, their difficulties adapting to new situations, the suspension of therapeutic support, ASD's frequent psychiatric comorbidities, and existing health inequalities between children with ASD and neurotypical children before the pandemic. But also, there are reasons to think that children with ASD could be less susceptible to the impacts of school closures. For instance, diminishing opportunities for face-to-face social interaction may reduce the risk of sensory overload and anxiety. So it's really important to figure out and understand what these effects were and how children with ASD were impacted. From my research, I drew out 4 key findings. Firstly, between a third to a half of children with ASD displayed more intense and frequent ASD-related behaviours. Predominantly, this included increased repetitive behaviours, worsening sleep regulation, and an aggravation of emotional and social symptoms. Secondly, children with ASD experienced major disruption to their health services and therapeutic support. Although some services were moved online, caregivers reported primarily negative experiences and low effectiveness. Also, parents reported that online classes did not meet their children's educational needs. Thirdly, a significant minority of the studies noted positive impacts. Consistently, these included improvements in verbal communication and cognitive ability, and this may be explained by frequent parental reports of more quality interaction time with their child. Unsurprisingly then, the fourth finding was that the evidence overall was mixed. Based on these key findings, I formulated some recommendations for both research and policy. On the research side, first and foremost, there is a need for further research, particularly into the factors that may account for the variation in findings. So, are there any social, economic, or clinical characteristics that influence how children with ASD are affected by the pandemic? Also, in the longer term, it's going to be crucial to consider whether the pandemic has served to widen health inequalities between ASD and neurotypical children. Turning to the policy recommendations, the literature indicated an urgent need to assess the effectiveness and accessibility of health services and therapeutic support as they move online and to prioritise their safe resumption. Also, if elements of online learning persist or are deemed likely to resume in the future, it is essential that schools assess the support provided to children with ASD. Now, I couldn't finish without shamelessly plugging in my research briefing. Thank you for listening.
Front-of-pack nutritional labeling has been shown to help consumers better interpret the healthiness of their food, but does this relationship, as well as the labeling's use, differ between different groups and communities? Hi, I'm Jamie, a recent population health graduate from UCL, and an NIHR SPHR intern in 2021, during which I was tasked with answering this very question with the team at the NIHR Obesity Policy Research Unit at UCL. As part of a range of health policies introduced by the UK government to address the growing issue of obesity, a standardized front-of-pack nutritional labeling scheme has been recommended to be used by major food retailers in the UK since 2013. These labels serve as easy-to-understand labeling on the front of packages. However, EU legislation required them to only be provided on food packaging on a voluntary basis. Brexit has allowed for the potential to change this though, with an opportunity to improve upon the design and implementation of such labels in the UK. The team at the NIHR Obesity Policy Research Unit therefore conducted an online randomized controlled experiment that tested the effectiveness of different FOPLs at improving participants' understanding of the healthiness of food items through a ranking task. Additional socio-demographic characteristics of participants and survey questions were asked as part of the experiment, but were not analyzed as it was beyond the scope of the study. I was therefore tasked with analyzing this additional data. One of my main findings was regarding the role of obesity in FOPL use, as we wish to investigate whether those who have a high BMI were less likely to accurately interpret the healthiness of food items with them, potentially hindering their weight management. Our results suggested that BMI does not play a significant role in influencing the ability of consumers to interpret and use all 4 analyzed FOPLs, and additional measures will be needed to tackle obesity. I also had the opportunity to help organize and facilitate a patient and public involvement session with a group of young research advisors aged 12 to 18. Through a scaled-down mini-experiment and guided discussion, we found similar improvements in understanding of product healthiness with FOPLs in children compared to adults. The children also showed strong support for the mandatory implementation of FOPLs, while also suggesting combining both the graded approach of the French Nutri-Score label with the nutrient-specific design of the UK's multiple traffic light labels to improve the current design. Following the internship, I decided to expand my work into my undergraduate dissertation, investigating the role of socioeconomic status in the use and views of FOPLs. My analysis did not find a significant relationship between socioeconomic status and FOPL's ability to improve consumers' understanding of product healthiness. But there were clear positive associations between socioeconomic status with participants' current use of FOPLs and whether FOPLs influence their purchasing behavior, with education showing the largest associations. These results therefore suggest that in order to address obesity and reduce health inequalities, further investments should be made into initiatives to reduce socioeconomic inequalities and improve education, in combination with implementing additional obesity-focused health interventions. After my internship, it was clear to me the need to further explore how these policies and obesity intersect with mental health. Therefore, to further my understanding of epidemiological research, I decided to apply for and have been successfully awarded a master's scholarship from the NIHR 3 Schools Mental Health Research Program following my internship. And I'm looking forward to continuing my journey in public health research during my master's in epidemiology at the London School of Hygiene and Tropical Medicine later this year.